Hello, my name is Dr. David Arnapol, and I'd like to thank you for coming to see my poster presentation information today. A few years ago, I was lucky enough to be volunteering with the syringe exchange clinic and got to know a lot of the clientele involved. Before the COVID pandemic, I had an interest in studying vaccines and specifically vaccine hesitancy. So I decided to utilize this knowledge that I had on vaccine hesitancy and begin to talk to the individuals at the syringe exchange. What I found was interesting was that these people who injected drugs were more than happy to receive syringes for drug injection or illicit drug use, but were as a majority uninterested in the flu vaccine. So I decided to use my interest and focus on their specific vaccine hesitancy and on people who inject drugs. What I did was I surveyed these individuals at the syringe exchange to get their viewpoint on vaccines, specifically the flu vaccine. I wanted to find out if they actually were vaccine hesitant, and if they were, what was holding them from getting the flu vaccine. As you can see on the results section of my poster on the left, some very interesting topics came from the survey, including people who felt that the vaccine caused the flu, some who felt they were unable to just access the flu because of cost, as well as topics of interest, including a distrust of the government and pharmacies who give or create the vaccine. I created an education that was then customized to these individuals based on the survey results. I spent a few weeks educating these individuals specifically with topics that they had told me about, especially if it was false information, or just to educate them about topics such as hand washing and where to receive the flu vaccine for free. And one more topic, of course, was how the vaccine works. After the educational time was completed, I resurveyed participants and serendipitously found out that vaccine hesitancy actually increased after the customized education. There are multiple reasons this could have been, including the fact that this was during a political time that focused on vaccines as a political tool. There was the COVID-19 pandemic, which, if anybody has research at that time, would be limited by this. However, the results were still very interesting. I hope to use this to find newer methods to educate individuals besides just through verbal education. I want to find methods that actually overcome vaccine hesitancy besides just speaking to somebody. I'd like to thank you all for looking at my poster and listening to my presentation today. And please feel free to email me if you have any questions. My cell phone number is on the top and my email is there as well.